Antianaplasmic drugs. What is anaplasmosis? It is an infectious disease caused by obligate intraerythrocytic bacteria belonging to the order Rickettsiales family Anaplasmataceae, genus Anaplasma. Vectors or fomites can spread the disease from infected to healthy animal. Anti-anaplasmic drugs. Anaplasmosis occurs in tropical and subtropical regions worldwide. The control of the disease is based on vaccination and chemotherapy or a combination of both. Vaccination can be done by using killed anaplasma vaccine in cattle or by using attenuated anaplasma vaccine in sheep. The latter provides better protection against natural infections than the killed vaccine by inducing stronger and long-lasting cell-mediated immunity. However, the vaccines are not commercially available. Chemotherapy is important in the control of anaplasmosis. Tetracyclines. Tetracyclines represents a broad group of antiprotozoal agents, some of which have activity against amoeba, mucosal flagellates, pyroplasms, and xylates. Examples: oxytetracyclines, chlorotetracyclines, doxycyclines, and minocyclines. Tetracyclines, chlorotetracyclines, and oxytetracyclines are equally effective against Anaplasma vaginal in cattle. Imidocarb, originally introduced as antibabesia drugs. It is found to be effective for treatment or anaplasmosis and elimination or carrier state. As effective as tetracyclines in bovine anaplasmosis, but it is more economical. Gloxazole. Chemically, it is known as dithiosemicarbaizone. It gives temporary curative effect and relapse almost invariably occurs in cattle within 1 month of treatment. In therapeutic dose, it is as effective as tetracyclines. Therapeutic dose at 5 to 10 mg for a single dose.